Hello, my name is Candace. I'm a nursing student and I'm going to go over the infant's first bath and some teaching with you. First, you want to gather all your supplies. For the bath, I have 2 towels, a receiving blanket, 2 washcloths. I have baby soap, baby shampoo is also fine, some petroleum jelly, and 2x2 gauze. Let's start by getting everything ready. We'll lay a towel out on the counter. We're going to get the bath ready. You want to fill the bathtub up to this notch here, which is about knee high on the baby. In the hospital, we use this liner, but you at home don't need to do that. Secure your bathtub in the sink and fill the bathtub up with warm to touch water. Some bathtubs will have a temperature indicator at the bottom. It may not. Once your tub is filled up with water, move the faucet out of the way so you don't bump baby with it. Now, let's come over to baby. We're going to get him ready to get into the bath. You want to grab a receiving blanket. Let's undo the diaper. Now I, as the nursing student, will be wearing gloves, but you at home don't need to. This is for the first bath only. If there's ever a time where you need to turn your back on the baby, you want to make sure to leave a hand on them. Like if they're on the counter and you forgot something, you want to place a hand and then get what you need to get. So we're going to corner the receiving blanket like this. Pick the baby up, supporting the neck. Bring the blanket down. And just loosely swaddle. Check your water to make sure it's still a good temperature. Bring baby over. We're going to work for the bath clean to dirty. So we're going to start with the head and the face. You don't want to use any soap. Never put soap into the bath water. And you don't want to use any soap on the face or the eyes. Go ahead and wet your washcloth. And we're going to work from the inner canthus to the outer canthus, the inside of the eye to the out. Move across, find a new clean area on the washcloth, and do the same thing to the other eye. You can re-wet your washcloth. Again, no soap on the face. And wash the face with only water. Now we're going to clean the ears without soap, only water. And you're just going to take the tip of your finger. You don't want to put anything smaller than the tip of your finger into the baby's ear because their eardrums lie very close to the surface and you could damage them. So just wipe off any wax. Wipe the ear. When you move to the other ear, find a new area on your washcloth and do the same thing. Now we're going to move down to the body. You don't want to put any soap into the bath water. So take your soap and just put it on your fingertips. You're going to expose one area at a time. So go ahead and work your soap in, washing the neck folds, and the chest, and your arms. And go ahead, take your washcloth and just gently squeeze water over to rinse. Once that area is done, you can recover it to keep baby warm and move down. If at any point the water becomes dirty, like baby has a bowel movement, you can stop, change the water, and start again with clean water and a clean washcloth. So we're gonna go ahead and put some soap on our fingertips and work it in, washing the genital area and the legs down to the feet. And rinsing again with the washcloth. Now, this mannequin is uncircumcised, so you can use soap and water. If your baby is circumcised, you do not want to use soap on their penis. It could burn and irritate. Only sponge bath with water. And if you see some white granulation tissue, that's just an indication of healing. You don't want to scrub that off. Something important to remember with an uncircumcised baby, never retract the foreskin. Forcibly retracting the foreskin can cause swelling and pain. And once you pull that back, it can be difficult to return it to its original position. All right, now once you have baby all washed, if you need to, you can lift up and wash the back, but because baby's not out running around getting dirty, sitting in the bath is sufficient to wash their back. Now that he's all clean, lift him out of the tub, being sure to support the neck, and place on your dry towel. Take your other towel here and gently dry. You want to go ahead and fold baby up, supporting their neck. And now we're going to wash their hair. You can take your soap, put a little bit on their head, and scrub their head. Now, don't be worried that you're going to hurt their soft spots. Shampooing their hair is not going to hurt their soft spots. So like I said, scrub their head a little bit with the soap. Take your clean washcloth. And again, if your water did become soiled, you can change it. And rinse. Now, we're going to come back over here and dry baby's head. The position I'm holding baby in is called the football hold. This is ideal for shampooing, breastfeeding, and eye contact. It also frees up one hand. It's also great for a sense of closeness. Now let's come back, and we're going to put baby in the bassinet, being sure that he's dry. Let's talk about some peri-care. One thing I do want to mention is that you don't want to use any oils or powders on your baby. Using oils can clog their pores, and using powders can be dangerous if they're inhaled by the baby. Now, so let's talk about circumcision care. If your male baby is circumcised, you want to take this gauze pad with a little bit of petroleum jelly and apply it to the tip of the penis for the first 24 hours. You want to redo this dressing every diaper change for the first 24 hours. After 24 hours, you want to leave it dry so that the circumcision will heal. You may notice some bleeding. If you do, you want to call your provider. You also may notice, like I said earlier, some white granulation tissue. Do not wipe that off. If you have a female, some things that you may notice are a white discharge. That's normal. You might even notice some bleeding. That's also normal as baby withdraws from mom's hormones. You'll also find some cheesy white discharge. That's the vernix, and that will go away with multiple washes. Now, to diaper your baby. Anytime that you change the diaper, you want to inspect for diaper rash or redness. So you want to take the tabs, the back of the diaper, and put it underneath. You may need to change the diaper as 6 to 8 times a day. You may want to put some Vaseline on the baby's bottom to prevent diaper rash. And for a little girl, make sure you're wiping front to back. You don't want to do back to front. That would take fecal matter and spread that up into their urethra, causing infection. Now, as we put the diaper on, be sure to fold the top of the diaper down underneath the umbilical stump. Covering the umbilical stump will delay healing. The umbilical cord will fall off, dry up and fall off within 7 to 10 days. If you notice any bleeding or signs of infection around the umbilical cord, please notify your baby's provider. Now, let's go ahead and put your baby's shirt on. These shirts are very loose. You go ahead and open it like this, gently putting it around baby's head. And you want to pull the sleeve back. Again, do the same on this side. This way, you don't have to tug on the arm. Now, we're going to be using the Halo Sleep Sack. This is part of our Back to Sleep campaign to help reduce the risk of SIDS. This sleep sack zips from the top down. So we'll go ahead and hang it here. Again, lift your baby, supporting the neck. Pull it up. This sleep sack eliminates the need for excess bedding, such as blankets, and you also don't want to have any bumper pads, toys, pillows, anything of that nature in your baby's crib with it. Only the baby should be in the crib. Some other things that can help reduce the risk of SIDS are using a pacifier at bedtime and nap time. Making sure your baby is always placed on its back to sleep. Not smoking in the house. Not using drugs. Not using any alcohol. You just want to pull this around, making sure that it's down from around baby's neck. One thing that also helps is keeping up with your scheduled vaccinations. And you also don't want to use any type of positioners, wedges, or home monitors. Let's go ahead and put your baby's cap on. Another thing that's very helpful is you want to keep the baby in the same room as you for at least 6 months to a year. But you don't want to share the same sleeping surface. Place your baby in its crib in your room, not with you in the same bed. One thing that can help is to do tummy time as well. This is only done when the baby is alert and awake and you are able to watch them the entire time. Never position a baby on its stomach when they are drowsy or when you are not able to stay there and watch them the entire time. Now, while we're here, let's go over some different positions for the baby. We talked about the football hold. I'll demonstrate again. Make sure you support the baby's neck. The football hold is ideal for breastfeeding, eye contact, and you also have a free hand. This is also great. We went over for shampooing and you also have a sense of closeness too. Now the other one, this one is called the upright. This is ideal for burping and creating a sense of closeness and establishing bond. When you do these different positions, make sure you support your baby's neck. And the last one I want to go over with you, this is called the cradle hold. You're going to have baby's head here, right here in your elbow. This is ideal for breastfeeding, eye contact, and it also frees up a hand. Again, you can see that this would help establish a bond as you can be close with your baby. Put him back. Do you have any questions? Is there anything else I can go over with you? Thank you very much.